Alright, so now we're going to start what in essence is the second part of Chapter 1. We're looking at the language of anatomy. So when we talk the language of anatomy, we're usually talking directional terms. The point of the language of anatomy is to be able to find structures relative to other structures. Know what area of the body we're dealing with. So first and foremost, you want to recognize that anatomical position is what we use to define everything. So when we talk anatomical position, we're talking literally here. Notice that the feet are parallel, okay? Palms are facing forward. Both sets of palms are facing forward, and arms are at the side. Everything in terms of anatomical position is related from this. So if we talk a direction from the midline to the right or the left, it's always from the midline here. So that means when we look at this, notice that the thumbs are not medial, they're not on the inside, they're on the outside, and that's important when we talk about and relate one structure to. Okay, so now notice also supine, lying face up, so that's when you're lying on your back face up. Prone, you're lying face down. Okay, now as we move on, again keep in mind everything is going to be related to this anatomical position. Notice here also they give you some planes. In other words, they're giving you directions, how we divide the body or transect the body. So we have what's known as a median or sagittal plane. Okay, that's this part. So medial and sagittal literally gives us right and left. Okay, so we have right and left halves. Okay, coronal or frontal, one of the terms you're going to learn here about coronal and frontal. Okay, frontal, where's the front of the body? Well, that's this part. So when we talk coronal or frontal plane, we're literally talking about a front and a back. Simplest way to think about it. Transverse, notice transverse, what we're dealing with is literally in essence, it's anything that goes across. So transverse or horizontal plane, we're looking at top and bottom. Okay, now what's interesting about the frontal and the sagittal plane, they can be at any point in that direction. The transverse plane can also be, in essence, oblique. That's still a transverse plane. So as long as it comes across in any direction, okay, if we transect the body into top and bottom, that's a transverse plane. As soon as we are completely upright and going right down this midline here, that's when we're dealing with a medial, okay, a medial or a sagittal plane. Median or metasagittal means right down the middle. So anything that transects it this way, no matter if it's right here, if we come down the plane here, whatever, that's still a sagittal plane. And notice frontal, same thing. Again, notice we're going front and back halves, so you can literally march this way with that frontal, and it would still be a frontal plane, any kind of transection through the body. Now, regional terms. The regional terms are really important for you to know. Those are some of those things you'll notice they're on the memorization quiz. You have to memorize this. There's no other way around it. As soon as you know the axillary region and you know that the armpit is where the axillary region is, guess what? You now know where the axillary vein is or the axillary artery. If we know where, here, notice it's referring to the kyphotic curve. Okay, well that's this area here on the back. Okay, temporal region, well, we know there's a temporal bone there. Nasal bridge, that's really hard to figure out. Again, you recognize how the changes, how these terms correspond to specific areas. So, submandibular area, well, sub, you all know that means below. Mandibular, referring to the mandible. Guess what? If you know where the submandibular area is, you know where the submandibular salivary glands are. Okay, that's what's going on. Those are the reasons you need to know these. So we have anterior landmarks and posterior landmarks. That's usually how it's broken down. In other words, what we've done is we've divided the body into a coronal plane. So we have front and back. Okay, so posterior marks, anterior marks. These are going to be the terms that we can see from the posterior, the anterior. And you've just got to go through and work at them and get them memorized. A lot of our posterior landmarks, for example, the scapular, the vertebral, the old cranal, are bony projections through the skin. So a lot of them you probably already know as common terms. Now you're just going to get the more anatomically correct term. So, big thing here. Again, notice anatomical position. Okay, we have the palms facing forward, feet parallel. All right, superior, inferior. Usually we group some of the directional terms. So we tend to group superior and inferior. Superior, okay, up, so something above something else. Inferior, something below. So keep it simple. The knee here, okay, is inferior to the hip, but it is superior to the ankle. You get the idea. Anterior, posterior, I already talked about that, in essence front and back. Posterior you'll also see sometimes as dorsal. Okay, anterior, frontal. So those are the interchangeable terms there. Medial and lateral. Okay, medial. Medial sounds like middle. That's exactly what it is. So when we talked about that medial sagittal line, you can see here, you can see this looks like a sagittal dash right here down the middle of the body. So that's the midline. That's medial. So anything that is in this direction towards that midline, that's medial. Anything in the opposite direction, in other words, towards the outside, away from the midline, that's lateral. So the axillary region is lateral, okay, to the pectoral region, okay, the muscles. Now, the pectoral region, though, would be medial to the axillary region. You kind of get the idea. So again, the thing you want to pick up on when we talk about these terms is they are relative terms. Okay, so that means, for example, our knee here, this was superior and inferior depending on whether we were dealing with the hip or the ankle. Okay, same thing with oftentimes with our medial and lateral. Where you see this matters when we go to name some bones. For example, your ankle here, you have what's known as the lateral malleolus and you have what's known as the medial malleolus. That gives you orientation. Okay, now proximal and distal, this is related to the point of attachment. So these guys are related to the point of attachment. Now that means, what are we dealing with? We are dealing with the limbs. So we're talking arms, we're talking legs. So medial and distal. The elbow, proximal and distal. The elbow is proximal to the point of attachment compared to the digits. All right. The wrist or carpal region is distal compared to the deltoid. You get the idea. So we're just talking point of attachment here. Superficial, deep, we're talking in terms of into the interior of the body. So superficial at the surface, deep going further into the interior of the body. So if you have a superficial wound, let's say you've scraped your knuckles, that's superficial. If you expose the bone, that's deep. Okay, you get the idea. Now, again, we've already talked about this a little bit. Sagittal plane, mid-sagittal plane. Notice it's a specific type of sagittal plane. That's where it literally goes right down the middle. Okay, frontal or coronal plane and transverse plane. And again, notice now we've incorporated our terms. We have superior and inferior associated with the transverse plane. Okay, coronal, ideally you should be talking, instead of front and back, you should either be talking anterior, posterior, or frontal, or dorsal. Okay, and then again, mid-sagittal, we're looking at lateral, so medial to lateral. Now, the pelvic regions. Oh, this is the problem with my slides. All right, so the pelvic regions, you kind of get the idea. Now, these bottom figures, A and B, they're in your book. Okay, so these are figures 1.8A and 1.8B. So what I've done is I've just taken these other ones and put them on top of those drawings in your book. The thing I want to point out here is notice that you can see there are, in essence, 9 regions when we talk. Okay, regions. Whoops. Regions, there are, come on. Oh, dang it, pen messed up. Okay. The regions, there's 9 of them. Quadrants, well, quad means 4. So we have 4 quadrants. Now, you see the left upper, left lower, right upper quadrant. When the quadrants matter, especially the right lower one, we all often associate that with appendicitis. This is associated with medical. This is associated with prognoses, diagnoses. When you're looking at location of injuries, you tend to deal with more general locations. When we deal with the hypochondral, epigastric, hypochondral, notice that we have left, right, hypo, below, chondral, that's a term that you're going to learn. Chondra usually refers to cartilage. Well, when you look at the picture in the book, you'll notice that all you can see here is just a picture of the bones. And you will notice this hypochondral region, and they've kind of outlined it here a little bit, is right here just below the ribs. Well, the ribs attached by cartilage, so we get the hypochondral regions. Epigastric, epi above, gastric, probably already familiar with, you think stomach. Umbilical, very easy, point of umbilical cord attachment. Lumbar, okay, again, notice that's the low back area, and what do you know? Your low back is known as the lumbar. So we have the right lumbar and the left lumbar, okay? Then we have the iliac, the hypogastrum, and the iliac over here. So hypogastrum or hypogastric, I'll probably call it gastric. Let's replace that with a C. Again, hypo, we've already said, hypo means below, so hypogastric, we're below where the stomach is located generally. Iliac. Okay, the iliac is literally referring to, it's part of the bone that sticks out. So if you put your thumb on your hip bone right here, okay, that's actually the iliac bone. So we call this the right iliac region, and this is the left iliac region. Now, something I want you to point out. Right and left. Notice right and left are not based on how you look at it. If you're facing this, this is actually your right side while you're facing it, but that's not the right side on the body. This is literally exactly as it would be on your body. So your right iliac region, if you take your right thumb and put it on your hip, you are dealing with the right iliac region. You get the idea. So again, left lower quadrant, right lower quadrant, right upper quadrant, left upper quadrant. Quadrants, again, we're talking 4. Quad tells you 4. Regions, there's 9 of them related to structures, okay, the ribs, the back, the hips, in the center, epigastric, umbilical, hypogastric, and then again on the right side we see the repetition of the hypochondral, lumbar, and iliac.